guys, it's Manu, Kalia, physical therapist and Ayurveda herbalist. So I'm going to show you a simple taping technique for ankle sprains and specifically inversion sprains. Those are the more common ones. That's where your foot turns in and you have pain, swelling, loss in range of motion or mobility in that ankle, maybe difficulty walking, playing sports. These are the common ones that a lot of people get. So, and you overstretch the ligaments, or you can strain the ligaments through here. You can even have tears sometimes. And you also end up getting sometimes positional faults. So the joint is kind of out of alignment a bit. And that sometimes stays there for a while unless it's corrected. And the person can have swelling or irritation lasting for months at a time. This is a simple technique to kind of bring the joint back in alignment. And what we're talking about is your lateral malleolus, or the outside of your ankle joint. And this is your fibula bone, okay, the outside bone, and the tibia is the main one, your shin. So we're going to work at gliding this joint back into alignment as it might get pulled sometimes with the ligament in the forward direction. So simple, 2 pieces of tape we're going to use. All we do is we measure it out. We're going to start here, okay? We start here, we're going to loop it around and come back and attach it here. So first I measure it out. I'm going to go here. It's a spiral taping technique. And I come up and I'm going to attach it right in front right here. Okay. So rip it. And so right here, okay. Make sure it's stabilized through there. Remember so the force is, my glide is posterior, going back and up a little bit, okay? So I pull it up in this direction. Remember, the ankle went this way, inwards, and I'm trying to get this back slightly in this position. You can even position yourself out a little bit, so it sets you in a good position. And I'm going to loop it around, and I'm going to attach it right here. Okay? Now, make sure there's space available. Don't overlap the tape. Okay? You want circulation. You don't want to bind up things. So we're going to loop it this way so that you can still have blood flow and circulation going on. That's one piece of tape, and I would do the exact same thing, and I would basically stabilize with another piece of tape there. So all I would do is I would grab this, place it there, and then I'll loop it around. Give a little pull with your fingers in the backwards direction this way, lightly, and then I keep the tension on the tape as I bring it around and attach it there. Now, those of you who have hair, like me, either you shave it off or you're gonna rip them as you take the tape off. So leave the tape on for about, I tell my patients to leave it on for about 24, 48 hours or so. Okay. So if your skin is sensitive, it causes any kind of itching, remember to take the tape off. Even if it feels good for the ankle and gives it support, you take the tape off because you don't want your skin to get irritated, okay? If it doesn't get irritated and it feels good, still leave it maximum about 48 hours or 2 days and then take it off, okay? So as I said, after you do your massage or manual work or exercises or other things, great way to finish off by taping yourself, especially if you're going to be up or on your feet walking around and doing things, and you can leave that tape on. So it keeps the joint in a better position. So it learns to be in a better position, and then it not only relieves the pain and facilitates the healing process a little bit better. All right? So easy technique to do, and you can use a few different types of tape. You can even use zinc oxide tape by Mueller. This is actually I like this one better. It's a Kendall wet-proof tape, a little bit thicker. I like this one. I don't think the kinesio tape doesn't stick as well, in my experience, for this kind of taping. So this one does a bit better. And make sure that if for some reason, if it causes you more discomfort, obviously take it off. Don't leave it on. Take your time taking it off. Soak the tape if you need to wet it so it comes off easier too. If you have any questions, leave a comment, subscribe to the channel, and click on the link below. Thanks.